A 16-year-old patient was infected with disease COVID-19 and had been receiving treatment in the COVID-19 intensive care unit ICU at the National Infectious Diseases Hospital at Liliendaal, Georgetown for some time now. This child was among the group of children who have been infected with this disease and have been battling the more severe symptoms associated with COVID-19. On Thursday, however, the child passed away while still in the ICU. The death was confirmed by Minister of Health Dr. Frank Anthony during his COVID-19 update.
We have currently in the ICU at the Ocean View, we have 10 patients as of today. Yesterday we had 11. We had one pediatric, I would say pediatric patient. In the medical terms, it's not considered pediatric because the person is 16 years old. So when I spoke yesterday, I was referring to that patient. Unfortunately, that patient succumbed. That patient had comorbidity. The patient had a form of cancer and unfortunately died over the last 24 hours. So here is a patient, relatively young, with a comorbidity and dying from COVID.
The 16-year-old patient, he explained, had cancer, which is considered a comorbidity. A comorbidity, according to the World Health Organization (WHO), refers to the presence of one or more additional diseases or disorders in the same individual. For example, an individual who is affected by COVID-19 is said to have a comorbidity if that individual also has an underlying condition such as cancer, diabetes, hypertension, or asthma. Meanwhile, this is the third child to have died from the disease in Guyana. Previously, an 11-year-old cancer patient who died at the Georgetown Public Hospital Corporation GPHC on November 6, 2020, was later classified as a COVID-19 death. In May this year, a young 17-year-old boy also succumbed after he was infected with COVID-19. The death of this child is not the only concern. Previously, the health minister said that a disturbing trend has been observed, with children becoming more severely affected by COVID-19, leading to an increased hospitalization rate. On Friday, he said that the number of children hospitalized increased beyond the reported 4 children.
As of today, we have 7 other children in the hospital. And again, we are monitoring these children. They are not in the ICU, they are in the regular wards. We are monitoring them. And this would have been an increase from yesterday. So I guess the point that was being made earlier, that we need to take precautions with our children, is very important, because we assumed, and initially, because of the types of variants that were circulating, where children, if they got infected, would have generally gotten a mild form of the disease. That pattern is changing. And we're seeing that children now are being affected in a more adverse way. So over the last month or so, we have seen more hospitalization with children.
When asked about the ministry's plan to deal with the effects of COVID-19 on children, and specifically children with comorbidities, the health minister said that parents and guardians must take the necessary precautions such as ensuring that masks are worn, practicing social distancing, and avoiding crowds to protect the children. Reporting for the newsroom, I am Vishani Ragabir.